Good morning and welcome to Super Healthy Super Mornings with Dr. Shilpi. So today I wanted to talk something very relevant to the topic of natural birthing. And when we are seeing people drifting away from this choice, which is a natural phenomena, stating various reasons, whatever said and done, maybe it is fear or maybe it is uh, a choice that they want to escape from natural labor pains, or maybe because of some muhurtam, or maybe because of some social reasons, maybe whatever notions that they have. But what is the impact of unnatural delivery like a cesarean, which is done for whatever actual reason not present? And what are the advantages of natural birthing on the child, and the impact of natural birthing on the child is what I wanted to discuss today. When it comes to natural birthing, it has got lots of advantages for the child itself, and we will talk about the topic of natural birthing and impact on the child health today, and same topic, natural birthing and impact on the child of the on the health of the mother, tomorrow. So when it comes to natural birthing, the word itself is a natural way of delivering the baby. And as far as for the baby is concerned, it's one of the safest choice, because the choice of delivery, absolutely, if the medical interventions were not there, was supposed to be only by one route, and that is the vaginal route, and it has been happening since ages. And just to improve the maternal health and improve the maternal outcomes, and also to cover the unwanted events, just in case whenever it is necessary, the choice of cesareans have come in. But they are not supposed to be the safest choice of birthing. Safest choice of birthing is definitely only natural birthing, and nothing but natural birthing and a normal vaginal delivery. When it comes to the safest choice, people do mix ideas and people do mix their notions, saying that safe is not with pain. Absolutely no. Whenever a natural mechanism is happening, your apprehension is increasing the pain sensation that is coming from the body, mind, and its connections. Whenever people do not have any apprehensions, I see so many young women who are just ignorant, who come from a village background, or who have no influence whatsoever from any of the other people. They just come, and they, at times I have to find for a wince on their face. I just look at them and I wonder where from she's so strong. For her, it is delivery and it will happen, and this is the level of their confidence. And they say from ages it has been happening, so why am I going to have a problem, especially when I'm in a hospital setup? So that confidence also is lacking in somebody who has got an alternative choice of hospital delivery, where they feel that by a cesarean also there is a safe choice. But safety wise, whatever said and done, you give the best of anesthesia services, best of surgeons, best of antibiotics, best of coverage and anything, but it's a surgical process opening the abdomen, and it has to be done only when it is really indicated in terms of maternal or the child health reasons, and not casually as an alternative procedure. So it is very important. The safest choice till date is only natural birthing or a normal vaginal delivery. But we don't have to take this choice every time if there is a real issue in the current scenario of any danger to the mother or the child. It is not to be opted for a cesarean just for the unknown reason of pain and fear. And whenever the baby is born by a natural mechanism, we need less intervention. And as the birth completes, we give the baby to the mother side, right on her abdomen, and ask mother child bonding to start, and spend those moments of enjoyment and those bliss by along with the partner and the mother and the child. So these moments are very important for them. And because it is a natural birth that has happened and everything is supposed to be natural, the bonding can start immediately. And there are very, very less chances of nursing care. And once the baby is born and mother child bonding starts, that is one of the best moment that anybody can expect. And there are very, very less chances of intervention from the other end, the pediatric end, or any other interventions that they need. And whenever a normal delivery happens, a natural birthing experience happens, it is not only about that day, that moment, and that process. There is an immense influence of this normal delivery phenomena on the immune response of the baby. The baby definitely has a better immune response in terms of a very strong and stronger immune response in natural birthing than a cesarean delivery, because of various reasons that we're going to talk about now. And why the strong immune response is there in the woman is in the baby is because in the natural process of labor and delivery, the baby gets exposed to millions and trillions of vaginal flora and bacteria, which are commensals. And they are the ones that overall they are inherited. What you give your baby as inheritance during the natural birthing process is this healthy bacteria, which safeguard the baby entire life, which safeguard the baby and give the baby natural immune response to various infections. This is the flora that gives lesser incidence of allergies and long-term asthmas and other small disorders that baby might face in future. So the importance of the vaginal germinal flora, I can talk endless about it. And this vaginal germinal flora is one such a beautiful entity that a mother can actually give to the child as an inheritance. And this vaginal germinal flora, which consists of millions and trillions of healthy bacteria, once it enters the baby, definitely it starts protecting the baby from various infections. And and the hormones that release during childbirth, especially in the vaginal delivery, are very, very important for the child. And this kind of hormone release that happen during a normal vaginal delivery enhances the mother-child bonding also. And the effect of these hormones are very good in terms of establishing lactation support, recovery of the mother, recovery of the baby, bonding of the mother and child. So there are so many advantages for this naturally forming hormones in the body due to the labor and delivery. And even for the baby, when the natural delivery process is happening, there are so many accommodative measures that happen that really help the baby in future coping up with the natural life outside. And it is very, very important that these aspects, which are not small entities, and these aspects which are very strong in terms of giving a very good immunity level to the baby, which cannot be purchased or bought from any store or any medical aspect or any we cannot replace this kind of naturally happening mechanisms by any mechanism whatsoever in an abdominal delivery or a cesarean delivery. And whenever the natural delivery process happens, there is natural squeezing of the liquid from the lungs. And whenever the baby takes spontaneous respiration, that natural respiration is very, very important in terms of giving the right output to the child. And this natural squeezing of fluid out of the baby's lungs improves breathing, improves spontaneous breathing, does not cause any difficulties. And sudden deliveries like cesareans, whenever the baby is just out in a minute or so after giving the anesthesia, and without the preparation, without the removal of the water naturally from the lungs, it is suddenly exposed to an environment which is foreign to it. And yes, in such situations we have seen lot of children, even full term 40 weeker babies, having difficulty in breathing because of the fluid that is retained in the lung, and they have distress, and they have to be at times put on CPAP, or 1 or 2 days of assisted ventilation is required, and then they are handed over to the mother. These situations are not uncommon, and that is, sometimes they have transient breathing difficulties, sometimes they have 1 day breathing difficulty, sometimes they have 2 to 3 days breathing difficulty. This is all because 90% of the time they are normal, but yes, the other times we do have complications of sudden exposure from the uterus inside the mother and outside environment. So this adjustment is not very predictable for every baby whatsoever it is. Even if you take it full term, even if you take it a planned vaginal delivery, even if you give steroid, everything to cover for the lung maturity of the baby, at times a sudden shock and sudden exposure to the external environment by a cesarean delivery can give rise to some kind of a respiratory shock and little respiratory distress, and it can be transient, it can last for some time. And there are at times when we have planned deliveries, and after delivery there is difficulty in breathing, difficulty in oxygenation, and we give the baby to the NICU for a short interval so that the oxygenation is assisted. So these things are really not uncommon, and these things are very much come with the cesarean process. And uh, this kind of a shocking situation does not happen in a normal vaginal delivery, unless and until you have any complications like meconium or motion that has passed and aspiration and all these things. Usually, most of the times when the normal delivery happens, the baby is all fit, unless and until there is any birth asphyxia or any insult that has happened. Usually the babies breathe well and they bond well and they're with the mother side, and uh, they have a lot of other advantages. And whenever natural birthing happens, the baby can be given to the mother side easily, latching can be started, breastfeeding can be started immediately, unlike operative delivery wherein the mother has to be, the surgical wound has to be closed and then shifted, and then latching is encouraged in most of the situations. But wherever I am, if we feel like latching the baby to the mother side and giving the baby to the mother side, if the baby is alright, we do it immediately also. But yes, that natural method of mother-child bonding is enhanced, and it is more vigorous and more established in normal deliveries, wherein immediate latching and immediate caregiving can be started. And whenever these kind of mechanisms come in place, we should be educating pregnant women that there are so many advantages of a natural birthing. Please do not go ahead with cesarean sections, especially for muhurtams or social reasons, or some fear of natural birthing, and somebody else's experience influencing you. Natural birthing is a very actually talking very blissful experience, and it happens, and it gives you that immense pleasure of being a mother, becoming a mother, and it gives you that satisfaction of going through something very natural. These days women are getting motivated and influenced in both sides. So I see equal numbers who getting encouraged for natural birthing. I see equal numbers getting encouraged for a operative delivery. But whatsoever it is, I try to give them counseling. I try to tell them that, see, this is what is the reality and this is what has to be taken into consideration, not any kind of fear. If it is only about pain, we'll try to figure out and give you the comfort that you want. But anything other than that, please do not have judgment about a procedure that really is called as a normal vaginal delivery and natural birthing, which has to be which has to be the primary method of delivery, and there should be no options given whatsoever it is. Then it's all about women, and it's all about their health, and it's all about empowerment, and it's all about taking care of their own decisions. At the caregiver side, we have every given method of giving them the information. The choice is definitely by them, because while making healthy choices, they should not fight within themselves, and it should be a uh, more willing consent to go through anything that is more natural. And there is a lot of partner role in it, and partner has to support in whatever decision that she is taking. So it is togetherness that they tide over challenges and move forward and have a very good natural birthing experience. So this is all about the impact on the child's health and long term impacts on the child health. There have been several papers that have said that childhood asthma is less in normal delivered children, childhood allergies are lesser in normal delivered children, childhood infections are lesser in normal delivered children, whether it is bowel infections or whether it is any other infections related to the body. They are very less in natural birthing and normal delivered children, because their immunity comes from the mother and the germinal flora that is there in the vagina. And it is very important to breastfeed the children, and natural delivery and normal delivery starts and kickstarts the lactation part also. There is natural flow of milk, and that enhances the sucking reflex, and then it starts that vicious cycle wherein milk sucking and milk increasing and sucking and milk increasing. So this vicious cycle is naturally started, and you do not have any artificial things to give and start, and it is a very smooth entry towards lactation also. There are very less lactation failures whenever you have natural birth and a normal vaginal delivery. So this is all about encouraging normal delivery, natural birthing. It is all about improving the child health. It is all about the next generations who are coming into this world. It is our duty to give them the best of outcomes for any procedure that is going to help them in future. So it's all about child future, and it's all about mothers who really think about their children from the day they are inside the mother. So it is all about your choices that are going to influence the child. So make healthy choices, make healthy decisions, don't be biased, don't be fearful. Everything is natural. That's why it is called a normal vaginal delivery and a natural birthing experience. So this is all about today, and so many people watching, and thank you all for watching. I wanted to have an interaction, so I was just asking for topics. If anybody wants any topics, definitely you can post in. I will check, and then I'll get back to you with the topics, and you can have information on that topics. So the series is going well, and it's all about encouraging vaginal deliveries, and it's all about teamwork. The team is not only the labor team, it is not only your doctor's team, it is the team in your house also. Your parents do matter, your in-laws do matter, your partner does matter. So take safe choices and good decisions. Be strong, and it's important that you take positive decisions for your health and the betterment of the child in future. So that's all for today, and see you all tomorrow. Yet another topic, the same topic, how natural birthing has an impact on the woman's health. So stay tuned, and see you tomorrow, 7:30. Super healthy, super mornings with Dr. Shilpi.